Dr. Adeel Khan, a specialist in regenerative medicine, discusses various topics related to chronic pain, fibromyalgia, chronic fatigue syndrome, toxic mold, and neurodegenerative conditions in a podcast. He emphasizes the challenges faced by patients who are left to figure out their conditions on their own after traditional treatments fail. Dr. Khan also highlights the growing interest in regenerative medicine and longevity as people seek alternative solutions to improve their health and well-being. Dr. Khan explains that orphan diseases, such as chronic pain, fibromyalgia, and neurodegenerative conditions, are not adequately addressed by the medical system. Patients often struggle to find effective treatments and are left to manage their conditions on their own. This has led to a growing interest in regenerative medicine, which offers potential solutions for these challenging conditions. Additionally, Dr. Khan discusses the concept of longevity and the desire to enhance the body's capabilities for a longer and healthier life. The conversation shifts to gene therapy, specifically focusing on a treatment called follistatin, which aims to increase follistatin levels in the body. Dr. Khan explains that follistatin is a naturally occurring peptide that decreases as a person ages. The treatment involves using a plasmid vector to deliver follistatin into the body, with the goal of restoring it to a more optimal range. He clarifies that this approach is different from gene editing technologies like CRISPR, as it does not involve editing a person's genome. Furthermore, Dr. Khan delves into the significance of vagus nerve treatments, which target the vagus nerve to modulate the autonomic nervous system. He describes how the vagus nerve plays a crucial role in regulating the body's fight-or-flight response and the relax and digest system. By injecting exosomes and peptides into the vagus nerve, the treatment aims to rebalance the nervous system and alleviate symptoms related to anxiety, PTSD, and chronic pain. The conversation touches on the challenges posed by FDA regulations, particularly regarding peptide therapies. Dr. Khan expresses concern over the recent restrictions on compounding pharmacies, which have limited the availability of peptides for clinical use. He highlights the impact of these regulations on patients' access to affordable and effective peptide treatments, emphasizing the need for more accessible options. Dr. Khan acknowledges the prevalence of vaccine injuries and shares his experience in treating patients who have developed adverse reactions to vaccines. He discusses the use of peptides, bioregulators, and stem cells to address immune dysfunction and chronic inflammation resulting from vaccine injuries. Additionally, he emphasizes the importance of rebooting the immune system and restoring balance to the body's inflammatory response. Dr. Khan provides examples of clinical applications for vagus nerve treatments, including cases of anxiety, chronic pain, and performance anxiety in athletes. He also discusses ongoing research and potential clinical trials to further explore the benefits of vagus nerve stimulation in treating psychiatric conditions such as PTSD and depression. Dr. Khan emphasizes the need for more data and research to validate the effectiveness of these treatments and their potential impact on long-term outcomes. Throughout the podcast, Dr. Khan shares personal testimonials and anecdotes from patients who have benefited from regenerative medicine and vagus nerve treatments. He highlights the diverse range of individuals, including athletes, veterans, and individuals with chronic illnesses, who have experienced positive results from these interventions. These real-life examples serve to underscore the potential impact of regenerative medicine on improving quality of life and addressing complex health challenges. Dr. Khan explains that beauty treatments using exosomes and stem cells can help slow down the aging process and improve skin health. He also discusses the use of brain tap therapy to rewire the brain and reduce stress and anxiety. He shares a success story of a young woman who experienced relief and relaxation after undergoing the therapy, highlighting the potential benefits of the treatment. Dr. Khan shares his personal experience with brain tap therapy, stating that it helped him manage stress and promote relaxation. He also discusses the potential benefits of the therapy for postpartum depression, emphasizing the need for resiliency in the body and the potential role of the therapy in addressing mental health issues. Dr. Khan discusses the use of second-generation exosomes and stem cells in beauty treatments, highlighting their ability to stimulate collagen production and tighten the skin. He also emphasizes the importance of individualized treatment and the need for personalized approaches to address specific health concerns. Dr. Khan mentions that chronic pain is a common issue among his patients and discusses the use of stem cell therapy to provide relief. He shares a success story of a patient who experienced significant improvement in arthritis after receiving stem cell therapy, highlighting the potential benefits of the treatment for chronic pain management. Dr. Khan discusses the use of immunotherapy in cancer treatments, particularly in Japan. He explains the different approaches to immunotherapy, including checkpoint inhibitors and cell therapy. He emphasizes the potential benefits of dendritic cells and natural killer cells in boosting the immune system to fight cancer. Dr. Khan also highlights the importance of individualized treatment and the need for personalized approaches to address specific health concerns. Dr. Khan discusses the importance of genome sequencing in personalized cancer treatment, citing the work of Dr. Tom Insulin in Scottsdale. He emphasizes the need for individualized treatment based on genome sequencing and the potential benefits of exercise with oxygen therapy and micronutrient protocols in cancer management. Dr. Khan explains the leading theory of toxin overload as a contributing factor in cancer development. He discusses the cell suppression theory and the role of intracellular pathogens, particularly fungal spores, in chronic diseases. He emphasizes the importance of high-intensity exercise and sweating to mobilize toxins from the body. Dr. Khan discusses the advancements in stem cell therapy, particularly the use of culture-expanded stem cells. He explains that the manufacturing process has improved, leading to a decrease in the cost of stem cell therapy. He also mentions the potential for 3D bioprinting to be used in clinical trials for joint resurfacing, which could revolutionize joint replacement surgery in the future. One of Dr. Khan's favorite treatments is vagus nerve stimulation, which he finds satisfying due to its immediate impact on patients' lives. He explains that the procedure involves resetting and rebooting the nervous system, which can be particularly beneficial for individuals with unresolved emotional trauma. He emphasizes the importance of instilling self-efficacy and creativity in children, as these are crucial skills for fostering resilience and success. Dr. Khan highlights the significance of addressing unresolved emotional trauma and its impact on mental health. He mentions the work of Dr. Russell Kennedy, who focuses on helping individuals work through adverse childhood events and trauma. Dr. Khan emphasizes the need for emotional intelligence and resiliency in children, as well as the importance of travel in broadening their perspectives. Dr. Khan discusses the challenges in the healthcare system, particularly in relation to the regulatory framework for innovative treatments. He points out the limitations and restrictions in the US and Canada which hinder the accessibility of advanced therapies. He also highlights the need for education on effective parenting and the development of self-efficacy and creativity in children. Dr. Khan shares his experiences with traveling to different countries to learn from leading scientists and researchers in the field of regenerative medicine. He emphasizes the importance of networking within the scientific community and the willingness of scientists to collaborate and share knowledge for the benefit of advancing medical science. Dr. Khan expresses his hope to collaborate with the government and regulatory bodies to advocate for the adoption of innovative treatments based on successful models in other countries. He also discusses the economic benefits of preventive measures and less costly treatments, which could potentially influence policy decisions in healthcare.